professional counselor.
Hi, I'm Dr. B, pediatric neuropsychologist.
So, welcome to Let's Talk. So, today we wanted to talk with you guys about different types of providers in the mental health field.
One provider that you may hear about is a psychologist. A psychologist is usually a PhD level mental health provider, or there are also psychologists who are what we call PsyDs. So that's one type of provider, the psychologist.
Now, you said you're a neuropsychologist.
Yes, so I am a neuropsychologist. So a neuropsychologist is also a psychologist, but neuropsychology is a specialty. And I will kind of talk about, the types of things that a neuropsychologist does in their practice versus a clinical psychologist.
And so I'm a licensed professional counselor, and I am also one of those type of people in the mental health family, as it were, along with psychologists, which are amongst the oldest, and social workers are two of the oldest professions in mental health. We also have licensed professional counselors, people like me. We also have social workers, master social workers, and clinical social workers. Also, we have licensed marriage and family therapists, and we cannot forget our medical doctors, the psychiatrists, right?
Psychiatrists, yes.
And so these different types of providers go through different types of trainings. For example, I mentioned that a psychiatrist is a medical doctor. So that means they have to go through the same thing that probably your PCP goes through for training, as well as the mental health or psychological component, including medication. And so there's a lot of things that are more medically meant with a psychologist than, say, with the other mental health professionals. Would you say the same?
With the psychiatrist, I would say that, yes, there's definitely, the medication is the thing that usually stands out between the psychiatrist and the psychologist. Psychiatrists can prescribe medications, whereas psychologists and other mental health professionals like counselors do not prescribe medications. Mm-hmm. And that's when we refer to psychiatrists, it's usually because we want some type of medication evaluation or intervention.
Yeah. And so psychologists, both psychologists and neuropsychologists, you guys don't do medication.
We do not. We have knowledge of different medications, particularly in neuropsychology and the effect that it has on cognitive functioning, but we will always refer to a psychiatrist for determining the most appropriate medication intervention.
Okay. And so then with the training with professional counselors, for example, a professional counselor has to have at least a master's degree in college in either psychology, counseling, or some sort of mental health field. And with that, after their education, they have to go into the next level, which is called an internship. And so here in the state of Texas, you have to have at least, right now, it may be changing, but right now there's 3,000 hours of postgraduate experience under the direct supervision of a licensed professional counselor supervisor. And the social workers and the licensed marriage and family therapists, they have their own set of rules that are pretty similar to that, but not exactly the same. And so if you were wondering about those, you could definitely go to their websites and check out what the requirements are for training for those specific providers.
Yes. Now for psychologists or neuropsychologists, the training can vary across programs, different graduate programs, and as well as the requirements across states can vary. But in general, a psychologist or neuropsychologist will attend grad school, we say for short, and that can range. It could range anywhere from 4 to 6 years, and for some people it may take a little bit more time. But generally, we attend a graduate school for some period of time, and that's usually followed by an internship, a year where we mostly focus on clinical practice. Following that year, particularly for neuropsychologists, we do a 2-year postdoctoral training. So after our year of internship, we have 2 more years of training. Some psychologists, clinical psychologists, also have this 2 years of training, or they may do 1 year of training. The overall idea is there's usually graduate school, internship, and some type of postdoctoral training.
So anyone that you see that's licensed, whether it be a psychologist, a psychiatrist, a marriage and family therapist, so on and so forth, do know that they are very well trained. They have to spend a lot of time and a lot of energy and a lot of time under supervision, so they're not just out there alone. There's somebody that's looking over their work and making sure that they're giving you the best that they can possibly give you. So why would you see a neuropsychologist, Dr. B?
Right. Well, a good reason to see a neuropsychologist is if there are cognitive concerns. And when I say cognitive concerns, that could mean for children, and I work with children, are there concerns about their ability to learn information or their ability to show optimal academic performance? For adults, it could be questions about memory. So someone is struggling to remember daily things, or there could be medical problems that would result in different cognitive concerns like memory or language skills or your ability to attend to information. And those are the kind of questions that neuropsychologists answer. Are there some cognitive concerns, and what can we do to help the child, adolescent, or adult with their cognitive problems?
Okay.
And how about you? What type of individual would you see?
As a licensed professional counselor, I see all different types of people for a number of different reasons. One of the things that I see children, adolescents, adults, couples, families, pretty much you name it. I don't see pets, I don't see them, but pretty much see everybody else in your house. And it can be for, sometimes it's the smallest things, as simple as just there's some kind of adjustment period that's happening, and you're having a difficult time dealing with that adjustment, all the way up to major diagnostic types of problems like major depression, anxiety, bipolar disorder, ADHD, any of those. And so it just really kind of runs the gamut depending on what's going on. And so anybody can really benefit from a professional counselor, or good counsel in general, because sometimes we have things that are happening in life that we just need an ear and somebody with perspective to give us a different perspective than our own. And so those types of things, those types of people are people that I see in my office, families who are going through major adjustment periods. Maybe there's a marriage, maybe there's a divorce, maybe there's a birth of a new baby and somebody hadn't slept in weeks. So, all those different types of things could be going on for somebody to come and see a professional counselor.
And I would say that that's pretty similar for clinical psychologists as well. Those are some of the same reasons why you would seek intervention with a clinical psychologist. And as we stated before, with psychiatrists, typically you're going to seek the intervention from a psychiatrist when there are concerns that there needs to be medication intervention.
Mm-hmm. Absolutely. Absolutely. Well, we're going to take it up to you guys to let us know if we forgot anything, or if there's anything that you want to know about mental health, about what we do, where we're located. We're going to give you our contact information in just a bit, but we want to make sure that you like us, share, give us your comments, tell us what you thought about this video, and if there's things that you want to know about, questions that you have, please feel free to let us know, because your question could be the next topic of our Let's Talk.
Absolutely. I agree with all of that.
Well, thanks for joining us today.
You.
Come back next time and we'll see you.